Hi, Dr. Scott Jensen here. It's December 20th, and I want you to listen to the sound this heart is making. Okay. Contrast that. So I think what you can get from that is the first two things I showed you were rhythms. Rhythms of the heart. The first one was irregular, consistent with atrial fibrillation. The second one was a regular rhythm, lift up, lift up, lift up, lift up. That's what we hear through our stethoscope. I'm getting a tremendous number of questions these days. What's going wrong with our hearts? And I'm seeing a lot of patients these days with cardiac manifestations. And there's a fair amount of news, but it seems like it's sort of going against the grain in a sense that it's not getting discussed openly. So I just want to show you on this heart, if you look here, you will see the blood vessels. I'm tracing them. If you will, the left main, and then you've got the right coronary. The heart has three parts. The heart has the blood vessels. I call that the plumbing. The heart has in this shiny portion, this is the heart muscle. And then embedded within the heart muscle is the electrical system. There are Purkinje fibers and an ability to have an impulse start high in the heart and gets transmitted to the rest of the heart. And then you'll see in the red here, you'll see the aorta, and then you'll see the vessels going up into the brain. I use this model to help patients understand what's happening. So what is happening? Let's talk about that just a little bit. First off, about a month and a half ago, there was an article called "Let's Declare a Pandemic Amnesty" by Emily Oster. And she talked about the fact that we need to start having open conversations with what's going on. But it's really not happening. And there were a lot of people that reacted. Some people were angry with her because they think that there are people that have to be held accountable for what they've said and done over the last 2.5 years. And there are others that feel like we don't have enough, if you will, of a basic understanding of the real science of what's gone on over the last 3 years with the pandemic, that it's too early to call for any kind of an amnesty. But recently, Dr. Aseem Malhotra, a leading cardiologist in England who's had a lot to do with the National Health Service over there. He's an award-winning consultant cardiologist. He's recently come out more and more outspoken with his concerns about the vaccine that's being offered now. Dr. Malhotra worked over here in England and initially was a strong advocate of the vaccines. Then he saw things happening, including an experience with his dad, and he has now changed his perspective. At the same time, Dr. Malhotra has been doing that. In America, we had Dr. Peter McCullough, and he is a cardiologist in Texas. And these two people, very separate, arrived at the same conclusions, that there's a problem. They have been in contact with outstanding, exceptional cardiologists across the world. We've seen numerous physicians speak to this issue. Some of the people that I've had a chance to interface with frequently include Dr. Harvey Reish out of Yale, Dr. Scott Atlas out of Stanford, Dr. Bhattacharya. I interface somewhat on social media with Dr. Koldorf. I think Dr. Ioannidis has had lots of things to say. But now, in the last 48 hours, I've been made aware of the fact that in Australia, this article, Dr. Karen Phelps comes out and reveals that both she and her wife suffered serious ongoing injuries from COVID vaccines. Now, what separates Dr. Phelps from the other physicians that have been speaking out? Well, she is the former Australian Medical Association president. She is a former federal MP. We're starting to see more and more of this. So if we're going to go back to Emily Oster's comments, let's do an amnesty, that means that we've got to have a conversation. So what are we seeing happen with the heart? Well, in the last week, I have talked with 3 different people. One person, within 9 days of receiving the vaccine, had, for the first time in his life, developed congestive heart failure, requiring hospitalization, removal of fluid, and fortunately, he's doing well. Never had a problem before, got his 4th mRNA vaccine, and this happened. Another person had a cardiac arrest within a few months of receiving the vaccine. And then I had another patient come in who had had a stroke within 21 days of receiving the vaccination. So what I want to point out that's really been confusing to a lot of my patients is they'll come in and they'll say, well, such and such person had a heart attack. And then I'll ask them to tell me this story. And I'll ask them, I said, are you sure that they had a heart attack? Or did they tell you that they had a cardiac arrest or a heart arrest? And they say, well, what's the difference? Let's go back to the model. So generally, a heart attack is because these arteries are plugged. Sometimes they'll be plugged 95, nearly 100%, and that'll cause a downstream lack of blood flow and oxygen, so the muscle will die. The definition of a heart attack, another word for it in medicine, we call it a myocardial infarction. Myocardial refers to the heart muscle. Infarction refers to death. So it's the death of at least a part of the heart muscle. And we generally confirm that through the elevated enzymes called troponins. So that's a heart attack. But a cardiac arrest or a heart arrest has to do with, if you will, the electrical system. And that can be related to a plugging up of the plumbing of the arteries, but it can also be an independent phenomenon that occurs in the absence of significant obstruction or plugging of the arteries. And then there's another thing that you might hear about called a cardiomyopathy, and that's where the heart muscle itself becomes sort of sick and inflamed. And oftentimes it could be secondary or caused by myocarditis. So you've got a cardiomyopathy that affects the heart muscle. You've got obstruction that affects the arteries. And then you've got rhythm disorders that affects the electrical system of the heart. Those are the 3, if you will, substantial portions that we have to be aware of. The thing that happens that's really been concerning to so many of us is when a cardiac arrest occurs in a young person in the absence of any significant plumbing problems. In other words, the coronary arteries, the left anterior descending vessel, the circumflex, the proximal, these are not plugged. And yet in the absence of that, we'll see, bang, a cardiac arrest. This is why there's been so much concern about young, fit, athletic people having abrupt deaths because of a cardiac arrest. Generally, when you're having a heart attack, usually there are some symptoms. The symptoms might be difficult to discern whether or not they're significant. It might be shortness of breath coming on with some mild exertion, perhaps shoveling snow or perhaps running, perhaps walking uphill. It might be chest pain. Oftentimes the chest pain is a squeezing or a pressure. Patients will tell me they feel like someone's standing on their chest. Sometimes it'll radiate it right into the jaw, and sometimes it'll be associated with a sweating or a nausea. Sometimes it'll feel a little bit like heartburn. But the bottom line is, when a person collapses with no preceding symptoms, and then if we're fortunate enough to bring that person back to life because we're able to, if you will, shock the heart with an automatic defibrillator, or if someone starts doing CPR, or if the heart spontaneously reverts to a rhythm that is sustainable with life. In all of these situations, when the workup is done and we evaluate thoroughly, if we see that there's no blockage, and we do an echocardiogram and we see that the ejection fraction is normal, that really concerns us, because that kind of abrupt onset indicates that something truly unable to be predicted is happening. And that is, I think, why we're starting to see people come out and say, we've got to start talking about it. Dr. Aseem Malhotra from Britain has been talking specifically about the cardiac manifestations. Peter McCullough has been doing the same thing. I think that it's quite extraordinary now that we're seeing leaders of a nation's medical association come out and say, hey, there's a problem. This Dr. Karen Phillips I referenced from Australia, she came out and she said that in my case, the injury resulted in dysautonomia. Well, that means that her automatic system, the system that we have that we don't even think about, the thing that causes our heart to beat, we don't cause our heart to beat, it just does it automatically. We don't think about breathing 16, 18 times a minute, it just does it automatically. Her automatic nervous system malfunctioned. She got intermittent fevers. She would get breathlessness out of the blue, inappropriate rapid heart rate, blood pressure would fluctuate. But she's concerned that there's been a lot of underreporting and under-recognition because people are frightened to say it. I'm thinking that if we're going to have substantial authors like Emily Oster saying, let's do an amnesty, then I would say let's do it all the way around. Let's have an amnesty and we can talk about it. Let's not talk about it with accusations and things like that. Let's just recognize what's going on. Let's not say, well, the people that you consider to be experts are not, and the people I consider experts are. Let's just stop that. Let's just say we got to start having a conversation. We're now having conversations about what's going to happen in the month of January and things like that. I wrote a book, and it came out about 5 months ago. We've been played, and this is what I said, and this was one of the hardest chapters I wrote, and the chapter was entitled, Should I or Shouldn't I? But this is what I said. This is why I'm so skeptical of all that's gone on. 1, the blatant profiteering by Big Pharma. 2, the unprecedented government overreach into the private lives of citizens. 3, the role of big tech in canceling opposing voices. 4, the betrayal and abandonment of patients by doctors and healthcare players. 5, ethical lapses by Big Pharma. In the last few days, I had the chance to have a conversation with a fellow who was an attorney prior to retirement for one of the major pharmaceutical companies that's involved in making COVID-19 vaccines. And the thing that really stunned him was, he said, I was shocked to see the speed with which this vaccine was released. He said, in his career with the major pharmaceutical companies that he was involved with, it would frequently take 7 to 10 years to get a vaccine from start to finish and, if you will, available to the public. Certainly 4 years was a relatively rapid timeline, but the idea of less than a year astonished him. And then he commented on the number of, if you will, significant adverse events that have been reported. He was even more concerned. He commented on the fact that even the CDC has acknowledged that there have been a tremendous number of reactions within a few days of receiving the vaccine. Again, if Emily Oster is going to ask for a pandemic amnesty, then I think we've got to have these conversations. We've got to be able to talk about these. And for me to be talking to, if you will, attorneys, big-time players for pharmaceutical companies that are involved with making cutting-edge vaccinations, we need to really pay attention. I went on to comment about the monopolization of the information. I talked about the lack of high-quality human data and the fact that sometimes the vaccines were approved for groups that hadn't been studied. And I went over a variety of things, but in the end, one of the things that was really problematic is we have a sense that fact checkers give us the information we need. Is this true or not? Is this misinformation or not? But honestly, what we've seen over the last many months is the fact checkers themselves have had some lapses of integrity. So I think that we need to understand a few things. We've got to have the conversation. So first off, what I want to leave you with in terms of a take-home message is in terms of what's breaking our hearts, what's causing our hearts to malfunction. Think of the three things. There's the plumbing, which is generally going to be problematic with heart attacks, and you're talking about obstruction generally. Sometimes you'll have maybe obstruction where the narrowing of the tube is perhaps 80%, 90%. Sometimes what'll happen is you'll have a significant obstruction and then there'll be a spasm of the vessel so that it'll clamp down, and whatever remaining opening there was for blood to flow is now closed off. And that can cause a heart attack, a vasospastic phenomenon on top of some present obstruction. That's the plumbing. Then we talk about the heart muscle itself, and that's where we talk about cardiomyopathy. That's where cardio meaning heart, and myopathy meaning myo is muscle and pathy is disease. So we have a disease or a malfunction of the muscle of the heart, and that's a cardiomyopathy, and that frequently does follow inflammation like a myocarditis picture. But then we have this other piece, not the heart muscle, not the plumbing, but we have the electrical system that's embedded within the heart itself. And when that electrical system misfires, I should say, and there is no underlying obstructive problem with the plumbing, and the heart muscle itself has been functioning normally with a normal ejection fraction of 55%, that really frightens a lot of medical practitioners, because those occurrences often end up in sudden death in a young individual in the prime of their life. So I think when people tell you that they had a heart attack, think of plumbing. When people tell you they had a cardiac arrest, or their friend or their family member had a cardiac arrest, it would not necessarily be related to any obstructive phenomenon at all. It might simply be due to a malfunction of the electrical system. And the question then has to be asked, what prompted the malfunction of the electrical system? What triggered it? And oftentimes it will be an inflammatory condition like a myocarditis. That's why so many cardiologists and physicians and scientists around the world are very, very concerned about the number of fit, youngish individuals experiencing cardiac arrest, oftentimes ending in death. Fortunately, in many situations, resuscitation has been successful. So I hope this helps a little bit, but I'm going to go back to what I started with. If we're going to talk about an amnesty for the pandemic so that we can move forward and do better the next time around, if we want to build trust, because I think the public health system has had the trust from the everyday person fractured. If we're going to do these things, then we have got to start being open about, let's have a discussion and stop the vilification of anybody that disagrees with you. I have tried to not say anything that would be, if you will, contemptuous or, if you will, particularly provocative. I am just explaining what's going on. And I'm seeing so much of it over the last few weeks that I'm concerned. And I just want you to be aware. Thank you. Have a happy holiday.